Good morning, gang. Happy Saturday morning. Okay, get into a lifestyle topic this morning rather than a current events one. Okay, so we'll get a little off the beaten path, but more toward what a lot of people really need to pay attention to. Was having a conversation yesterday with a couple of friends of mine in the medical field. And the topic started out, we were just talking about Gene Hackman's autopsy and his wife and everything like that, and how strange it was that supposedly she had died 6 days earlier than he had, and he never called anybody or anything like that, and then he died. And I mean, there's stories out there that he had Alzheimer's, and I'm not going to go into that whole deal. But it brought up a topic that we were all discussing, or I was asking questions of them about what you should do as we get older. If you are ill, if you have to go to the hospital, if you're on hospice, anything of the sort, right? Now, mind you this, about 2/3 of the viewership of this channel is over age 55, okay? So for the most part, we are getting close to or already in our senior years. So medical bills, medical visits, whatever, probably are going to become a little bit more common for us than when we were younger. So it brought up the topic of me asking, what are some things that those of us who are older need to make sure of before we ever go in the hospital, or if we are in hospice or need a live-in nurse, anything, okay? And they gave me a bunch of good answers. Some were more comfort items, but I wanted to stick with more of the traditional how to deal with the system, okay? So the first thing they told me was beware of the red tape, okay? That it is insane what they have to go through to get you into a needed surgery. You go see your regular doctor for something. Okay. Well, now you have to go see the specialist. And the specialist, of course, is telling you that, well, before we do surgery, we want to try this, and we want to try this, and we want to try this, and all this stuff costs money, okay? And so now, while they recommend it, your insurance may not pay for it. And you go, okay, now I'm out of pocket $500, $1,000, $2,000 to try all these ideas to fix my problem, and it didn't get me anywhere because the insurance company wouldn't pay for it. So, as they were saying, don't just take whatever your doctor says as gospel and go do it. Sometimes you have to put your foot down and say, no, that's stupid. Let's get in here and just get this taken care of once and for all. And that's that, because otherwise remember what they're trying to do. They just want to push you off to somebody else, okay? You've already been in the doctor's visit. They got paid. They're looking at this going, you know what? If we do this surgery, we get paid $5,000. If we do this surgery, we get paid $1,000. Get the $1,000 guy out of here. Let's get a $5,000 guy in. It's the same time, right? So beware of the red tape. This is one thing that they were telling. Doctors' offices, hospitals, etc., and insurance companies do not get along. So make sure you've got all your ducks in a row and stand your ground. That was the first topic. The next one, which kind of segued into it, was expect incompetence. And again, the exact same scenario I told you. It's like, well, I really don't know, but I can't tell them that I have no idea what really is the cause of this. So let's just see if we can buck it over to somebody else and they'll figure it out. Okay. And I mean, this is all pre-going into the hospital. I'm not talking about incompetence of the doctors, the nursing staff, whatever, the anesthesiologist. We see stories, I don't want to say often, but enough about people in hospitals where nobody follows the instructions on the chart and the person dies, or they amputated the wrong leg, or whatever, okay? You need to make sure that everything is taken care of correctly. I mean, it's to the point silly enough, let's say you're going in for an amputation. Take a Sharpie and write on your leg, not this leg, and on your other one, the one that's supposed to be amputated, this leg. Just to make sure they cut the wrong one off. I mean, how many times have we seen people, heard stories, going in for having their appendix removed, and the next thing you know, it's like, oh, they got a kidney transplant or something. I mean, I'm joking in that one, but that's how silly it is. I'll give you, doctors are overworked, no question. It still amazes me every time I hear these stories about doctors. I'm on a 72-hour shift or whatever it is. I don't want some guy cutting me open who's been awake for 2.5 days. His head ain't there, okay? Don't tell me that you're now going to be perfectly ready to go. You can't train yourself for that. You are tired. So assume incompetence is going to be part of your medical visit. Which brings us to the third one. And this is one that they harped on with me, is that everybody has to have an advocate, okay? Somebody to stand up for them, somebody to make decisions for you when you're out. If you're unconscious, they can't ask you, hey, while we're here, do you want me to do this? You need to have, man, throat's hoarse this morning. You need to have somebody who's got a power of attorney. I mean, not just I'm her husband or I'm his wife, not that sort of stuff. You need to have a written document, power of attorney, signed, sealed, notarized, whatever it needs to be, that says you have authorization to make all medical decisions for said patient. And you have the right, while somebody's while somebody's in the hospital, while somebody's hooked up to God knows how many machines, to ask as many damn questions as you want. Because the medical staff normally will again try to push you off. Sir, I don't have time. I have to get to another patient. No, you stand your ass right here and you answer my questions until I'm satisfied. If not, we can have a conversation with the medical review board. Okay? We need to be forceful in taking care of ourselves. Doctors are not gods. As we are all looking at the future and what it holds for us, I don't know, I'd like to see 85 or something. I'm not leaving it up to some quack to decide whether or not I'm going to make it or not. Conversation. This is one that kind of ties in here. Having conversations with your doctor beforehand. What exactly are you going to do? What if this happens, et cetera, et cetera? Like I said, you have a long sit down. You talk to whoever's going to be involved. If that means talking to the anesthesiologist, if that means talking to the insurance companies, you need to do that before anything, okay? Obviously, if it's a car accident, you don't have that choice to have that conversation. But this goes back to why you've had a conversation with your spouse, with whoever has your power of attorney, to make sure they know what your wishes are, okay? Simply put, this is what I want them to do, this is what I don't want them to do, which comes up to the final point of having your advanced directives, okay? Having a DNR, do not resuscitate, okay? You're in a car accident and all of a sudden you're in a coma, you're in a vegetative state. They can't ask you if you want to continue like that for another 20 years. If you got it on paper saying, I do not want to be, if I'm brain dead, unplug me. You need to have that written, signed, sealed, delivered so they can hand it to the doctor so everybody's good and they can unplug you. Otherwise, you are saddling your family with millions easily worth of bills forever. You know, maybe you want to be kept that way. Maybe you absolutely refuse to, let Aunt Martha go. I get it, okay? Maybe you're like, if it happens to me, I don't want to burden the rest of my family. If I ain't coming back, Christmas doesn't mean anything to me, and it's only pain for them if I'm laying in a hospital bed. And the final advance directive, obviously, and we've talked about this one before, is have a will. It's not that difficult to get a will done. It's not that expensive. You can do them on your own. Literally, I mean, obviously, if you have a business and everything like that, that's a little difficult. Your multiple heirs, that might be a little bit difficult. But if you're like a lot of people, that the primary will is, if I die, my wife gets everything or my husband gets everything, that's a simple will. And you need to have that done, because in the event of you dying, somehow, your bank account, your car title, whatever, if it's just in your name, now they've got problems if they want to access it or sell it or whatever. If they've got a will that says they are the sole heir to everything, the title company, the state goes, oh, they're dead, you're the heir, cool, here's the new title. Simply put, most states have rights of joint successorship. Okay, the wife will, or the husband will, inherit everything upon the spouse's death. Not all of them are like that. And the last thing you want to do is put your spouse through some long probate hearing or whatever, going through everything. Again, this is make your wishes known. None of us are going to live forever, guys. Okay? Nancy Pelosi might, Keith Richards might, okay? Because they're pickled about as much as you can be. I think they've been dead for 20 years anyway. But we're all going to have medical issues, and eventually we're all going to die. Make sure you do your best to prepare for those scenarios, which most of us are going to face. The death one, all of us are going to face. God help, God love you if you never have to see the hospital before the day you die of old age. But chances are we're all going to have to. Make sure you've got these things taken care of. Let other people know your wishes. Okay? Make sure you're talking to your doctors. Make sure you're talking to your insurance company. Do not for a second think that the medical field or the insurance companies have your best interest in mind. Maybe the doctors did 30, 40, 50 years ago, but for them, just like for the insurance company, you're just dollar signs. That's it. They don't care. They don't care about your name. The only thing they care about is how many numbers are after the little dollar sign in your bank account. Pinball out.